Kia ora koutou. I'm going to be slightly different, take a slightly different approach. I've got 4 things I want to talk about today. So I'm a medical doctor and with public health training in epidemiology, and this is why I do what I do. So you can see there that when we're looking at transport, not only is it a really significant greenhouse gas source in this country, but it's also got a whole lot of health effects there, both good and bad. And we know that at the moment the current configurations of our transport system cause as much death and disability each year as tobacco or obesity, probably more actually. And we also know that the system we've got at the moment is incredibly unfair. So it contributes to the life expectancy difference between Māori and non-Māori in this country. And there are a whole bunch of people who are completely excluded by it and unable to access those benefits because of how we set it up. So the research I do is really in the co-benefits area, thinking about how we can reduce emissions and also improve health, wellbeing and the things that are worth living for. And I want to say I do that with a whole bunch of really awesome people, some of whom are on Zoom at the moment as well, so I want to acknowledge all of them. The first thing I'm going to talk about 4 different areas of research that we do. Not in a lot of detail, don't worry, but if anyone is interested, they can come and talk to me afterwards. The first bunch of research we do is using a whole lot of routine data sources to look at inequities in the transport system. So we've done work around how Pacific people travel compared to non-Pacific in this country, socioeconomic inequalities and greenhouse gas emissions from different forms of transport in this country, and we're currently doing some work looking at Māori transport outcomes as well. If we're going to design good policy, we need to know what is going on in inequities at the moment. We need to design good policy and we need that information to evaluate whether it's working or not as well. The second bit of work that I wanted to talk about in this space is looking to the future a bit more. It's basically, we've got a big model. I'm not a modeller, so this makes me very uncomfortable, but somehow I've ended up involved in a modelling project. Basically looking at different transport scenarios and looking at the health, greenhouse gas emission, equity and some economic outcomes of it. So at the moment we're using this model to look at the transport pathways from Inaya Tonu Nei, the Climate Change Commission's report, and looking at what the long-term out to 2050 health, equity and greenhouse gas emission outcomes for tailpipe and non-tailpipe emissions are. So asking questions like what will be happening with transport injuries, what will be happening with depression because of changes in physical activity associated with the different transport pathways. So that's looking a little bit more to the future. We're using it for those particular scenarios at the moment from the Climate Commission, but really this model can be used for almost any kind of transport scenario that we could think about. The third bit of work I wanted to talk about is my really fun bit. And that's thinking about e-bikes. So we know from international literature that e-bikes reduce VKT and trips by somewhere around 20%. But I would suggest that there hasn't quite been the level of policy interest in e-bikes as a sort of a contributor to reducing emissions as the research might suggest it's possible. So the work I'm involved in at the moment is an e-bike pilot project in Wainuiomata. So we have 25 e-bikes that we've given on long-term no-cost loan to whānau associated with the marae out there. So these are people who did not cycle before we loaned them the e-bikes, some not for 25 years. And we've loaned them the e-bikes and we've provided supports in the form of locks and all of the training and that sort of thing to see how they go with this. And we interviewed them all before we gave them the e-bikes, and they gave us a very, very long list of why people like them couldn't ride e-bike, couldn't cycle and didn't cycle. And I'd really like to show you a video now of the interviews with some of the participants that were done about 2 months into the project, which was done by wonderful Luke over here.
Life-changing. The health benefits, the mental health stuff, diabetes, helping with the blood pressure, gout, weight loss, connections that we've had with our moko, and of course with my wife and I. So it's been an amazing journey.
From where I park up from, which is Seaview, Petone, by the time we get into Central City, 25-minute bike ride. I love it, it's wonderful.
Got to go out with my daughter, especially over the summer holidays, going out on some night rides. So without the e-bike, I probably would never have done that.
4 nights a week, 7 o'clock, I meet up with the Ride or Die team at the Rugby League Club, and we go off. We usually do between 30 to 35 kilometres. So if I just need something from the shops, I use my bike. It's just given me another form of exercise so that I can continue on the journey that I'm on, yeah.
I use it all the time, as often as I can. In place of the Netflixing, watching TV, just lounging around the house. We could do that for 2-3 hours easy, but now we're out on our bike. We travel over the hill, we've been to Wellington, we've been to the end of Eastbourne, we're venturing into Upper Hutt. We want to go to Nelson.
Twice a week I take my dog out on the trailer. My dog's a Kui, she's 14, she's 3-legged, so she loves it. She loves it, and I love it, yeah. It's so freeing, you know, it's like I can just grab it and go.
I'd just get home and I'd just go into my room and just stay there. And now I've got an excuse to use the e-bike and go on it. And I like going to places where it's all quiet and times when it's all quiet. So I've been down to the catchment and been there by myself, and it's just me being there and just breathing in the fresh air and just being able to not be in my room anymore.
For there where Waka Kotahi has given us another 6 months. Unbelievable. So obviously the program works.
So I'm sure you noticed there that no one was talking about greenhouse gas emission reduction or mode shift. They were all talking about things that meant something to them and improved their quality of life. And I think we need to talk about that more. And finally, my final point, because I'm probably running out of time now. 2 minutes. Whew, that talking fast worked. I'm really, and a group of us, we're really interested in thinking a bit more about why it is, when the evidence is really clear about what works to both reduce emissions and improve health and improve equity, why we're not doing enough of it and why we're not doing more of it. So we're in the process of starting a bunch of research trying to shed light on some of the processes around this and thinking about what's holding this system in place, this system that it's unhealthy, it's inequitable, and it's environmentally destructive as well. So I'm happy to take questions about any of that later, or have conversations with people or email follow-up.